Welcome everyone to this PHSW PhD information webinar. I'm Dr. Naomi Stecklenburg, Researcher Advocate for the School of Public Health and Social Work. I'll be moderating today's webinar and introducing you to our presenters. To begin today, I'd like to propose a thought for you to carry with you as you listen to these presentations. To be awarded a PhD, you must show evidence, data, critical investigation, but the best PhDs are also founded on the imagination, the ability to ask, what if? Today, I'd like to invite you to invoke your imaginations, to ask, what if I could do that? What if that were possible? What if I chose that or this supervisor? What if those people became my team? Because as much as anyone who has been awarded a PhD has been determined, able to navigate and organise data, critically adept, they are also driven by this question of what if? How could the world, my world, look if only I were willing to take the dive? This webinar is brought to you by QT PHSW. You can connect with us on Facebook and Twitter, where you'll be able to read stories of the PhD researchers who have come before you and some of the people and research that got them there. In terms of housekeeping, please put all of your questions in the chat. At the end of the session today, we'll address them. You are welcome to move in and out of the webinar according to the presentations most appropriate to your area of research interest. But I encourage you to stay for the next few speakers who will provide you with an overview of our school, as well as some of the nuts and bolts of application. For the purpose of clarity, you may hear us refer to PHSW. This is short for the School of Public Health and Social Work. You may also hear the term OSHI. This is short for Australian Centre for Health Services Innovation. Let's start. To open our webinar, we welcome our Head of School, Professor Hilary Bambrick. Professor Bambrick is a seasoned academic, celebrated globally for her research on how climate change is bad for health and what we need to do about it. In keeping with our school's commitment to advocacy for a healthy, fair and inclusive world, in 2016, Professor Bambrick was appointed to the Climate Council. Welcome, Hilary. Where is Hilary? It seems we have a little technical problem and Hilary is actually not here, so we might resolve that and meanwhile move to our next presenter, who is Professor Louise Hafner-Bishop, our Faculty Director of Research Training. She's going to say a few words by way of introduction, and she's told me that she won't be saying too much today because she's keen to give the floor to supervisors. Louise?
Thank you, Naomi, and welcome everybody to this exciting webinar. It's really my pleasure to introduce you to some of the Faculty of Health.
Seems we have a little technical issue.
Sorry?
Oh, Louise.
Okay, everyone can hear me, I hope. Yes?
It seems we're having a little trouble hearing you. Can
everyone hear me now?
Having trouble?
Put your hand up if you can hear me. Okay.
Okay.
So as I was saying, welcome to the Public Health and Social Work Spotlight on Research. It's very exciting and a great opportunity to listen to all the research that's happening in the School of Public Health and Social Work. So in the Faculty of Health, there are 7 schools and we have many HDR students within the School of Public Health and Social Work. But these students, the HDR students, both the PhD and the MPhil students, have the potential to collaborate with researchers not only across the 6 other schools in our faculty, but also across different faculties. So the other schools that we have in our faculty are optometry and vision science, biomedical sciences, psychology and counselling, clinical sciences, exercise and nutrition science, and the School of Nursing. So you can see that even if you join the Public Health and Social Work School, you'll be able to interact with many different HDR students and researchers across all of these different areas. Currently, we do have over 600 HDR students within our faculty, and this is, makes up about 1/4 of all of the HDR students at QUT. As the Director of Research Training, I have the real privilege to oversee the research journeys of all of our faculty HDR students, and this includes both international and domestic students, PhD and MPhil students, and part-time and full-time students. Within our faculty, we have very much strong support for HDR students, both at the academic and the professional levels. And we do this via a number of ways. We use accredited HDR supervisors and mentors in supervisory teams for students. We closely work with the HDR administrative team. The team leader who is joining us today, Emma Kirkland, is going to talk to you a little bit more about milestones and PhD journeys. We have university level strategy meetings with the Research Degrees Committee and work closely with the Associate Dean Research in the Faculty of Health. We also work with the Graduate Research Centre, what's known as the GRC, and the GRE+D, or the Graduate Research Education and Development team, to improve offerings for students as they're going through their research journey. So it's in particular looking at skills development for research and career skills. And so, for example, there are modules like transdisciplinarity in research, learning how to work with other people, to work on the wicked problems, and to work with industry and other partners and other faculties. Finally, we do work closely with the academic lead postgraduate research, Dr. Sanjeewa Kularatna is with you today, and also with the academic lead research, Dr. Lisa Marie Toms in the School of Public Health and Social Work. In short, it's a great faculty, a terrific school, and there's lots of support for HDR students. So we welcome you joining, and hopefully you'll find some interesting research areas to lead into your next adventure. So that's all I have to say today. So thank you very much and enjoy your webinar.
Thanks, Louise. It seems that we've fixed the technical problem with Hilary, so we can go now to her. Now we're doing things in a little bit of a topsy-turvy way. We're actually going to open the webinar now with Professor Bambrick. So Hilary, would you like to take the floor?
Thanks, Naomi, and thank you to Louise. That was a lovely welcome, and apologies for appearing to be absent. It's quite unusual to sit there and be speaking and not have anyone hear you. So thank you for that. Okay, so I'm here to tell you a little bit about what the School of Public Health and Social Work is about. And to do that, I'm going to first of all read to you, a little bit what our sort of vision statement is. So through our research, teaching and community and industry partnerships, the School of Public Health and Social Work strives for a healthier, fairer and more inclusive society. We focus on the prevention of disease and illness, the promotion of better health and well-being, the improvement of health systems and services, and the provision of quality social support. All of our work has embedded principles of social and environmental justice and human rights. So what does that actually mean? So it means at the very core, we care about people and the impact that society, culture, and environment has on them. We put health and well-being into context to really get at the heart of what's going on. We look outward and we examine the evidence. We collaborate and create to deliver solutions to problems and discover new ways of doing things. We don't stay in the world of theory. We get out there, we get our hands dirty. We're known for our strong partnerships and engagement, working with community and industry. Here in the School of Public Health and Social Work, we're not into slapping on a band-aid, we're into changing the world. As a student with us, you'll benefit from the huge range of expertise in our academic supervisors, whatever your topic or approach. If you're really into collecting and analysing quantitative data, we've got world-leading biostatisticians to guide you through. If you're interested in interviewing people about their life experiences, we've also got you covered. And if you don't think your topic fits within a particular box, not to worry. Supervisors frequently work with students in multidisciplinary teams, so you have a range of knowledge and opinions to draw from. So we've already had an introduction from Louise today, but you'll also hear from a sample of our researchers and both supervisors and current students about the sorts of topics that they work on, as well as some information on how to apply and what to expect as a student. Thanks, Naomi.
Thanks, Hilary. Next up, we have Professor Stephen Macphail, who is the Academic Director of OSHI and who leads the health management discipline at our school. He's going to speak to you a little bit more about the benefits of doing your PhD at our school. Thanks, Stephen.
Thanks, Naomi. We're probably running a few minutes behind time now, so let me cut straight to the chase. I'm very pleased that you've all been able to join us. And I'm just standing in actually in this moment for my colleague, Dr. Lisa Marie Toms, just to tell you a little bit about why doing a PhD with us is a good idea. And I've really broken that into two components, because you're going to hear a lot about from supervisors who have specific projects. But let me tell you a bit about why doing a PhD is a good idea and a worthwhile thing. And for me, really, it's changed my life. So, you know, I think if I think about it, you know, what a PhD is, it's a bit like a golden key in many regards. So if you want to do research in a particular field that changes that field, you're going to need a PhD. And if you want to change the world more broadly through good research, you're definitely going to need a PhD. But it's much more than that. If you want to take on senior leadership or executive roles in public or private sector, a PhD used to be sort of viewed favorably, but now it's almost becoming an expectation that people moving into senior leadership roles have this capability. And organizations want their leaders to be dynamic, able to drive research and innovation, and be able to interrogate emerging evidence. And there's you know, in the information age, we have emerging evidence, but evidence emerging at a faster rate than we've ever seen before. We've seen this recently, of course, with COVID and loads of really dodgy information coming out around COVID. And the importance of being able to interrogate and understand what's good and what's not, what's in the middle and why, and how that impacts our decisions is really important. So there's the aspect of actually being a researcher. There's also an aspect beyond that goes far beyond being a researcher into being a dynamic driver of good decisions based on good evidence. And I think that having a PhD sort of demonstrates you have capacity in this area. And lastly, on a very sort of personal note, if you want to sort of have a steeper career trajectory, then a PhD is definitely helpful for that. Although I don't think that's the main driver for most people. It's actually because we want to have an impact on the world and change the world. And that really brings me to the next point, which is why do a PhD with School of Public Health and Social Work? You're about to hear from a whole bunch of really inspiring people who do great research. And in our school, we have a very broad church, multidisciplinary team of academics, people who are in industry and close to industry. And most of our projects are actually in partnership outside of the university with industry partners, government partners, international partners. And this connectedness, this really makes us, I think, a really great place to do a PhD. And if I were to sum it up, I'd say there's three things about our school. There's the people. You'll hear from a bunch of great people shortly. But even beyond that, throughout the school, I mean, that's really what attracted me to this school, is that I work with people who I really respect and enjoy working with. They're good people who are out to change the world in a positive way. And that inspires me every day. We have really good projects that span a wide range of things. And then, and you're gonna hear about a section of this, but across our disciplines of public health, social work and human services, health safety and environment, health management and health services innovation, health information management, digital health, all these things are opportunities to really change the world, and not in a sort of you know, idealistic, unattainable way, but in really concrete steps that are going to impact not only the small segment of the world, but actually the world at large. And so I think this is a really exciting time. These are exciting areas to work in. And if you are indeed thinking of taking on a PhD, I can strongly encourage you to do it with us, because we have a unique team of people, good people. We have good projects, and we're well connected and with good partners. So without further ado, I'll let some of the other people speak. But let me thank you again for bearing with us through the technical challenges that we've just had. Thank you. And perhaps may continue to have, we'll see.
Thanks, Steve. We're going to move on now to we've kind of had our inspiration, and now we're going to move into some of the nuts and bolts of the PhD. And to do that, we're going to hear from Emma Kirkland, who is the HDR team leader for health client services within the Graduate Research Centre. Her team supports MPhil and PhD students from the time they make the first inquiry about applying for admission. So that might be the stage that a lot of you are at now, through to the time when they complete their course. So Emma and her team will be the ones who'll be guiding you through that process. And she's going to be giving you some good tips today, I think, for how to get things rolling in a PhD with our school. So thank you, Emma.
I do have a PowerPoint to share as well, so I'm just going to bring that up for everybody. I won't be a second. Okay. Thank you so much for having me. As Naomi mentioned, my name is Emma Kirkland. I'm the team leader for the HDR Client Services team. When I say HDR, I mean a higher degree research. You might hear that said a bit today. And Naomi's absolutely correct. So we do help students right from the time that they apply for admission to the PhD, right through to the time that they complete. So we do get to know our students quite well. And it's really lovely experience getting to know them as well. Okay. So what does a research degree actually involve? You're going to be hearing a lot about this today. But in a nutshell, the MPhil and the PhD are an in-depth program of original and significant research, which includes a literature review, research design, data collection and analysis, and this culminates in a thesis that is examined externally. So the MPhil and the PhD, they're both time-based degrees which are punctuated by candidate milestones to assess progress and provide feedback to the candidate along the way. In health, there is actually only one compulsory coursework unit, and that's the Advanced Information Research Skills unit. And this aims to provide the foundations for undertaking high degree research and to provide scaffolding for your first milestone, which is the submission of a research proposal. That being said, candidates can also elect to undertake additional coursework units in the areas of research methods, and that's if they need a refresher in those areas or if they need to address any knowledge gaps as well. That being said, though, it's not all just about the thesis. So our HDR students do undertake other research activities along the way to enhance their career opportunities and develop their researcher profile. So these activities can include the write-up and submission of papers for publication, which is an exciting part of the journey. Also, the presentation of your research findings at both domestic and international conferences, which the faculty very kindly provides funding for you to be able to do that. It's also an opportunity to engage with industry and external partners and also undertake paid industry internships if that's something that you're interested in. It's also collaborating and networking with experts in the field and engaging with the extensive suite of professional development modules that QUT offers to both MPhil and PhD students. So rather than just seeing it as a PhD, it's actually a PhD plus, because you're getting to do all these additional things, and QUT does aim to ensure the employability of our students as well. So we do offer two Faculty of Health Research higher degrees. So the first one being the Master of Philosophy, which is typically 18 months to 2 years full time. Entry requirements can be via an honours degree or a bachelor's degree in the relevant field. So the bachelor degree must also contain a relevant research component with a minimum GPA of 5.0 on a 7-point scale. And then we have the Doctor of Philosophy, which is between 3 and 4 years full time. Both degrees can be undertaken part-time for domestic students if you need to. And entry to the Doctor of Philosophy is by way of the Honours Class 1 or 2A, can be via Research Masters or a Coursework Masters. If it is via Coursework Masters, we need to ensure that you have a minimum research component of 25% of the total credit points, and with a GPA of a minimum 5.0 on a 7-point scale as well. So I'm not going to talk to this slide too much, but I have provided a bit of a flow chart to see the various study pathways that are available to students to get into either a Master of Philosophy or the PhD. And I have provided the links here as well so that you can go and have a look and see more about what is involved with undertaking each of these degrees and what the eligibility requirements are. I have listed professional doctorate here for you. It's important to note that we no longer offer the professional doctorate through the Faculty of Health. It is only offered through the Faculty of Education and Creative Industries, and I'm aware that other universities also offer professional doctorates, but in case you are looking for other faculties, the information is there for you if you need it. So how to apply? So we have just received some exciting new information this morning that we are upgrading our application process to a new online system, which will be launched as of the 17th of August. So even though we are still accepting applications through the current process, that will be available up until the 13th of August. We are, however, recommending that if your application isn't urgent, it would be a better experience for you to hold off until the 17th of August to submit your expression of interest and your formal application for admission. So if you do have a scholarship offer and it's quite timely, then absolutely go ahead and submit your application before the 17th of August. Otherwise, if you can, it'll definitely be a better experience for you if you can wait until the 17th. So it is a two-step process, the application. So the first step is an expression of interest phase. So all you need to do at the moment is contact us at hdr@qut.edu.au, and we'll put you in contact with the academic lead for postgraduate research. And they will actually have a chat with you about what your research interests are, and they'll align you with a supervisor for your project. And then your supervisor will meet with you as well. They'll have a chat with you. They'll help you to refine your research proposal, and they'll help you put your application together for formal admission. So you, as Stephen was saying, you may choose to apply for an existing research project that's being advertised through the school, or you may have an original research proposal in mind, and that's absolutely fine too. If you're not sure what your research interests are at this stage, you're most welcome to go ahead and visit our START database, where we keep a list of all our available projects that are happening within the Faculty of Health, just to give you an idea of what you might be interested in and the people who are in charge that you can speak to about those particular research areas. Similarly to the change of our application process, we are going to be soon moving from the START database to a website where we house our research project topics, and that will be happening in August as well. So these PowerPoint notes have got all the relevant links to the current information and the new information. So I think Naomi or someone is going to be sharing these PowerPoint slides to the attendees, but you're most welcome to contact me as well, and I'm more than happy to share them with you as well. So it is important to choose a topic that excites you and that you're passionate about, because challenges will arise during your research journey that may test your resolve along the way. So it's really important to keep that focus and the reminder of why you chose to undertake the PhD in the first place. And it goes back to what Hilary was saying, is that you're actually creating new knowledge and you're changing the world. So it's a pretty big thing to be excited about. So the last thing that I will mention is the annual scholarship round. So we do have an annual scholarship round for QUT once a year, and this year it will close on the 30th of October. I've got a link here to the online information, and the application guideline will be updated this month, later on in July, and I definitely recommend that applicants read that very, very closely. So just to let you know a little bit more about how we assess applications for the scholarship round, it is very competitive. We do have a success rate of about 20%, going from numbers in previous years. So it's really easy to apply. It's through the usual application for admission form. It's just a little tick box that you need to let us know that you'd like to be considered for a QUT scholarship, and we'll pop you into the pool and we'll assess you. So the faculty has their own scholarship criteria, which is also available on the QUT website, and you can have a look at those in that link through the PowerPoint. But we have 3 criteria that we assess against. So we've got academic merit and research achievement, which is worth 60% of your total score. Secondly, we assess according to the research environment and the supervisory team. So that's worth 20% of the score. And lastly, we assess against the research project and strategic alignment with the school, and that's also worth 20%. So definitely recommend you having a chat with your supervisors as well during that application phase to see what else you can include in your application to make you that little bit more competitive. So things like highlighting in your CV any research outputs that you may have already had. So things like authoring, especially if you're first author, authoring publications, presenting at conferences and things like that. We want to know about all the research experience that you've had up until this point. So that's about all from me. I have got my contact details there. Absolutely welcome to call me or email me anytime, and I'll definitely be able to organise a time to chat with you about the admission process. And yeah, so thank you to the School of Public Health and Social Work for having me. I really appreciate it. Thank you.
Thanks, Emma.
I'm just trying to figure out how to stop share. Oh, here we go.
Thanks, Emma. That was really informative. I might get you to pop your email address in the chat so that anyone watching who's keen to get in touch with you and find out more of those details can do so. Next up, we have someone who has gone through the process and has just finished his confirmation, actually, which is one of those milestones that Emma was talking about. It's Aaron Akpu-Phillip, who's a doctoral researcher at our school, and he's also the HDR representative at PHSW. So he's going to share a little bit of his experience of being a PhD researcher with us. And he's also going to let you know about some of his schools and his team's terrific access to peer support and community at our schools. So I'll hand you over to Aaron now.
All right, thanks, Naomi. Can everyone hear me?
Yes.
All right, thanks, Naomi. Hi, everyone. My name is Aaron Akpu-Phillip, a PhD student on the Julie King, my principal supervisor. As Naomi mentioned, the HDR representative for the School of Health, School of Public Health and Social Work in QUT. We've got Emma has said a lot about this, and we're going to hear more from other researchers in the school. But as a PhD student and a HDR representative, this is a new role, but together with support from Naomi and Sanj, the research advocate and academic lead postgraduate research, we're rolling out some exciting projects that will sort of hold the HDR community together to make sure that this is not just a PhD journey, which is of course very academic, but we need to also with the support of the team, bring in a bit of fun and make sure that you are kept together with, kept in touch with other HDR students within the school. We're rolling out things such as the social media platforms where we keep to engage and share research that has been done by PhD students across different platforms. There's also, of course, very exciting social media research, social media trainings that has been held all throughout the degree, which is, of course, fronted by Naomi and Sanj with very close support from us. Because of how daunting and how challenging we understand the PhD journey can be, especially with the bureaucracies in the institutions, in the schools, I work very closely with my deputy Asif, who were very, very approachable. And because we have close links and in touch with most of the lecturers and the research advocate and the academic lead in the school, we're able to provide more guidance for you if you're thinking of coming to join us in the School of Public Health and Social Work. You're going to hear very, very exciting projects from the lecturers in the school. And because, of course, I'm a PhD student, I've been through the process of admissions and all of that. And I must say that this is a very, very exciting platform for you to learn and hear about the projects that are going on. This process is going to also help you to shape your research proposal and probably get a potential supervisor. Before I applied to join the School of Public Health and Social Work, if I had this opportunity, obviously it would have been very, very fast for me. Aside the very accommodated lecturers we've got who are very, very responsive to emails, which again slows the process, which again makes the process of you getting a PhD very fast in KUT School of Public Health and Social Work. This webinar will obviously pinpoint some of the projects. If you're thinking of various projects across the school, across industry, this webinar provides that platform for you to sort of shape in your thoughts, meet people, connect and network with academics in the field, students like myself. And we're also open to providing support if you want to get in touch with us to provide any support while you plan on joining the School of Public Health and Social Work. So thank you very much, Naomi.
Thanks, Aaron. We're very pleased to have Aaron and Asif as our HDR representatives, and they do a fantastic job of keeping everyone connected and making sure that there are opportunities to make contact and to really form that community, which is a very important component of actually completing your journey. So we'll move on now to the next section of our webinar, which is where we're going to be featuring speakers who are potential supervisors. They're going to take you through some of their research interests and let you know of some of the projects that they have available. And first up, we have Dr. Susanna Cram, who's a Strategic Research Fellow at QUT's Institute for Health and Biomedical Innovation. You might hear that word come up in talking to people about a PhD. Often that is referred to as IBI. And she's also involved with two QUT centres, the Centre for Healthcare Transformation and the Centre for Data Science. Susanna also holds adjunct positions at Menzies School of Health Research and the University of Sydney. To ensure her research has impact, she works with leading institutions across a range of health conditions, including the Jamison Trauma Institute, Diabetic Foot Australia, and Cancer Council Queensland. She's received many awards, including Science and Technology Australia, appointing her as a superstar of STEM. Now that's someone I really want to know, a superstar of STEM. I'll give you the floor, Susanna.
Thanks so much, Naomi. Share my screen. Okay, can you see that all right?
Yes.
Awesome. Cool. Thank you. Hello. So have you noticed that COVID-19 is impacting certain segments of the population more than others? These can be defined geographically, like Melbourne and Victoria, or by other features like income, and often the poorer do seem to be more affected, whether that's because of comorbidities or greater economic impact from having less secure work and minimal savings. But it's not just COVID-19. Australia has huge health inequities across many conditions. In fact, health inequity has been described as the preeminent challenge facing Australia's health system, and specifically inequities resulting from where people live, their race, and their income. My research program is called Health Equity Research with Outcomes, also known as HERO. We use statistics and epidemiology to help identify, understand, and address health inequities. A lot of our work has focused on chronic conditions. One of my PhD students who recently finished was actually investigating dengue fever. So really, there's a lot of options in terms of what health condition you focus on. My group's only small. I currently have 2 PhD students, 2 finished recently. Another one's due to start soon. But we're based within OSHI, the Australian Centre for Health Services Innovation at QUT. It has a great group of students and researchers and a really supportive environment. So current large projects in HERO include investigating cancer, diabetes, and injuries. Whenever possible, as Naomi mentioned, we work collaboratively with the agencies that are involved in this space. So that includes Cancer Council Queensland, Diabetic Foot Australia, and the Jameson Trauma Institute. Now, my specialty is modelling disease outcomes across small regions. I actually did my PhD at QUT, exploring differences in cancer incidence and survival across Queensland. And I saw the government actually act on my research to provide additional support to rural cancer patients, which was incredibly rewarding. The success of that work resulted in developing the Australian Cancer Atlas, which is now freely available online. So one of my PhD students is now mapping small area patterns in prostate-specific antigen testing to see if it's driving the prostate cancer incidence patterns. But additional extensions are planned to the atlas, like looking at changes in cancer patterns over time. And there's plenty of scope for PhD students to be involved in that. With Jameson Trauma Institute, we're also starting work on a Queensland Injury Atlas. This will investigate how a wide range of injuries vary across the state. For example, falls, assaults, traffic accidents, and self-harm. We have one PhD student who's likely to contribute, but there's room for others too. Likewise, we'll be mapping small area patterns of diabetes-related complications, like toe and foot amputations across Queensland. But maybe you like data analysis, but you don't want the complexity of these spatial or spatiotemporal models. There's plenty of other aspects that can be investigated, like considering the inequities relating to race or income, factors influencing survival or disease progression, or ways to prevent different diseases occurring. So if you meet 4 criteria for my group, which are you enjoy analysing data, you understand statistics or epidemiology, you're comfortable using statistical software like R or Stata, and you want your research to really make a difference, then feel free to contact me with your research interests and background. So I wish you every success in your future endeavours. Thank you.
Thanks, Susanna. Heroes and superstars, that pretty much sums up the school, doesn't it? Next up, we've got Dr. Victoria Mckenna, who is a health economist at OSHI and the Jameson Trauma Institute at Royal Brisbane and Women's Hospital. She's got expertise in the analysis of linked administrative data sets. She currently coordinates a multidisciplinary project aimed at streamlining fracture rehabilitation using smart technology with expertise from rehabilitation researchers, clinicians across orthopedics, physiotherapy, orthotics and prosthetics, as well as an international industry partner. Take the floor, Victoria. We'd love to hear from you.
Okay, oh, okay, great. Thanks, Naomi. So my name is Victoria Mckenna, and I am a health economist and health services researcher. As Naomi said, I'm currently working part-time with OSHI, the Australian Centre for Health Services Innovation, but I spend most of my time over at the Jameson Trauma Institute, which is embedded within one of the big hospitals in Brisbane, the Royal Brisbane and Women's Hospital. So I'll tell you a little bit more about that later. I thought I'd start by talking about my experience with OSHI. So I did my PhD with OSHI, and so I can support all of the statements that both Will and Steve and Susanna have made about working with researchers at OSHI. If you do your PhD with OSHI, you very much feel part of the research team. You're not just a student. You're treated as an independent researcher, just like everyone else in the team. And I think that's really special because it really enables you to take the lead on your project, but have the support of very experienced researchers across statistics. We have clinicians. You've seen Will speak. He was actually one of my PhD supervisors. Health economics, qualitative and quantitative research skills. So I can really support that. Working with OSHI to do your PhD it's a great place to be. So my PhD was an economic evaluation looking at trying to understand the long-term costs and health outcomes for patients with stable heart disease. So overall, the aim was to generate evidence for decision-making about resource allocation. So how should we best allocate our money, our limited healthcare resources, so that we can get the most health gain from that money? And as Naomi said, I've used primarily administrative data sets. So those usually what are collected by the hospitals when patients come in for treatment. And those are coded with diagnosis codes and procedure codes and those sorts of things. So really, so I use that to then generate economic models to assess the long-term costs and health outcomes of different treatment pathways. So a lot of the time is spent figuring out how to use the data to get the information that I needed. And I had a lot of help from Will Parsonage, who, from the clinical perspective. So I guess while my PhD experience is in heart disease, the benefit or the beauty of health economics is that you're not limited to one disease area. So as long as you have clinicians who can advise you on the clinical aspects of your project and making sure that you're answering a real clinical question in a valid way, you can really explore any area of healthcare or disease area. So I really enjoy that aspect of health services research. It's very collaborative. I really enjoy working with clinicians and industry partners to help answer those real world questions. And that's something that OSHI and the School of Public Health and Social Work do really well. We're very much engaged with clinicians within the health services, which means that we do research that is relevant to clinicians on the ground. So that sort of takes me to Jamison Trauma Institute. As I said, we're embedded in the hospital. So a very similar approach to what I feel at OSHI. So we're embedded in the hospital, which means the research can be driven by clinicians. They're right there on site, so it's much easier to get time with them. I can just pop across the road to the hospital and meet with them when they have time, and that's really really beneficial to the research that we do. So I'll just give you a little bit of background to the Trauma Institute for those who aren't familiar with it. It's a partnership with Metro North Hospital and Health Service. So that's the Royal Brisbane Hospital is part of that, and the Motor Accident Insurance Commission and QUT and some other smaller partners. But those are the three key partners. And we have 8 themes: quality of care and process, injury prevention, data quality and analytics, which I'm quite heavily involved with, clinical trials, there's an education and training stream, rehabilitation and outcome measurement, which I'm also involved with, virtual trauma care, and then diagnostics and innovation. So my key projects at the moment are the Smart Ankle project, which Naomi also mentioned. So we're using smart devices to try and monitor weight bearing during rehabilitation for patients with ankle fractures. And that includes clinicians from orthopedics, physio, orthotics and prosthetics. And we have an international industry partner, as well as researchers from QUT and the Queensland University of Technology, and of course the Jamison Trauma Institute. And my other projects involve using those administrative data sets again, but this time in the trauma space. So we're kind of swimming in data over here, and we need more people to come and help us answer some clinical questions from that, from those data sets. So really keen to, for anyone who's interested in that type of work to approach me and approach us at JTI. Also, another key project is about opioid use following trauma. So that's got linked data from hospitals out to community pharmacy or community use of opioids. So in summing up, my interests are health economics, specifically cost effectiveness analysis to improve the efficiency of health services. I'm really interested in what we can do with existing data sets, because we collect a lot of data in Australia and I mean in other places around the world. And so there's a lot of potential to to improve efficiency and make difference to the health service just by using what we already have. And I'm also quite interested in improving the collection of patient-reported outcomes. I didn't really touch on that, but as health economists, that's something that that's quite a challenge. They're not often collected, but they're actually the outcomes that matter to patients. So In terms of topic areas, I guess it's quite a broad range of things, but as I said, anything involving administrative linked data in the trauma space. I've got quite a few colleagues over here at Jefferson Trauma Institute who can also help out with that kind of research. So feel free to get in touch. Thanks.
It sounds as though, Tori, you've got some incredible opportunities there for PhDs. I've got a PhD already. If I didn't, I would be there.
Okay, great. Thanks, Naomi.
Moving on now to Dr. Hannah Carter, who is a health economist, another health economist, and research fellow based at OSHI, and she's been there since 2005. She's experienced in conducting economic evaluations across a wide range of clinical trials and health services research projects, and has contributed to the teaching of OSHI's short course on cost effectiveness analysis. We're really glad to hear from you today, Hannah, so take the floor.
Thank you. Thanks, Naomi. I'll just try and share my screen. Where are we? Okay. Can everyone see that and hear me okay? Yeah, all good. Okay. So hi, everybody. Really exciting to see so many people attending today and interested in learning a bit more about doing a PhD. So a little bit about me. I've come to health research from an economics background. So I did an undergrad degree in economics at UQ and then went on to do a PhD in health economics at Sydney Uni. So my PhD involved developing new modelling methods to estimate productivity related costs of premature mortality in Australia. So that involved working out the net loss to the economy associated with deaths that occurred before the retirement age and how this impacted on national labour force participation and income. So beyond my PhD, I've been based largely at OSHI since 2015, not 2005, and my research has largely focused on how we can achieve the best value for money from our healthcare budget. So this includes conducting economic evaluations within the context of both formal clinical trials as well as in more pragmatic health service implementation studies. Unlike some of my colleagues, I don't have a clinical background or any particular disease areas that I focus on, but I've worked across a number of different clinical areas, including cancer, cardiovascular disease, diabetes, neurological conditions, and more recently on studies in paediatric cohorts. And that's one of the reasons why I love this job. There's always a lot of variety and there's always something new to learn. So more recently, my work's starting to focus on estimating the financial impacts of illness on patients and on their families, as well as estimating the economic costs associated with implementation. Okay, so now I'll just focus on or talk a bit about the types of PhD topics I would be keen to supervise, either as a primary or an associate supervisor. So I'm conscious that some of you might have come here today with a topic already in mind, while others have potentially got no idea what a PhD might look like for them. So I have one slide for both of those groups. So for those who do have a study, innovation or patient cohort in mind, the types of things I'd be able to help you with is if you wanted to build in an economic evaluation or a cost effectiveness analysis into your study. If you wanted to do some modelling of a health system in order to look at where efficiencies can be gained. If you wanted to look at estimating the financial impacts of illness on patients, or if you wanted to estimate a national economic burden of disease. So alternatively, if you've come along today looking for ideas and inspiration, then I also have some potential topics up my sleeve. So one idea would be to look at the health service use and costs associated with neurological conditions, things like MS, Parkinson's disease, motor neuron disease, epilepsy. I currently have access to a large data set that contains linked data on all hospital admissions, ED presentations, outpatient appointments, costs and mortality data on patients with these conditions across Queensland. And it also includes really rich information on a number of patient level variables such as Indigenous status and postcode. So there's definitely some interesting research questions that can be addressed there around whether there are inequalities in access to healthcare as well as health outcomes between different groups, whether that be Indigenous Australians or people living in rural and remote areas or people on lower incomes. A second topic that was that one. A second topic I would be really keen to supervise would be in estimating the relationships between child disability and parents' employment, income and financial stress. And I'm able to access some data to help look at that question. Another one is exploring how policymakers account for patient out-of-pocket costs and productivity costs, so those costs that fall outside a healthcare budget, and how those costs influence decision-making in healthcare. Another topic would be, yeah, something else I'm interested in looking at is how healthcare funding mechanisms can either promote or discourage high value care. So that could involve looking at whether our current activity-based funding system is working in Australia and whether there may be better options available. And finally, the last thing I'll mention is that there would definitely be a good PhD in looking at methods and tools for estimating financial impacts of illness on patients. This is something that's not done particularly well at the moment. So I will leave it there. Please do feel free to get in touch with me if you'd like to discuss any of these topics further, or if you had any other ideas. Best way to get in touch with me is via my email. And thank you all for attending, and I hope you enjoy the rest of the webinar.
Thanks, Hannah. You're unsharing. Thanks, Hannah. Oh. Thanks, Hannah. I'm sorry, did I say that you've been working at Oshi since 2005? That would...
Yes, that's all right.
That would mean you were basically there in diapers, which is quite amazing. Okay, we're on now to Dr. Adem Sav, who is a senior lecturer in health, safety and environment. He's currently a recognised leader in the area of policy and systems approaches to health, and is particularly focused on a setting approach, e.g. looking at workplace influences. So I'll hand over now to Adem.
Thank you very much for that wonderful introduction, Naomi. I'm just about to share my screen. Let's have a look. Share screen. Yep. Okay. So who am I? As Naomi said, I am the discipline leader for Health, Safety and Environment program at QUT. I've got a background in psychology and public health, particularly focusing on occupational health and safety. And I completed my PhD in 2011. And you're probably wondering why I've got that picture there. That's because my PhD was around work-life balance and implications for health and well-being. And despite doing a 3.5-4 year PhD on the topic, I still don't have a very good take or grasp on work-life balance. I'm still struggling to balance work and non-work commitments myself. So word of advice, just because you do end up doing a PhD on a particular topic doesn't mean that you'll be able to help yourself. You may be able to help others, definitely, but in terms of helping yourself, it's a little bit more complicated. I also thought about, when I thought about presenting what sort of research I'm interested in, I thought the best way to describe it was give you an example of Brian, who's our 52-year-old female, a friend who is a senior marketing professional working for a large marketing firm. So let's just go through this, and I'm trying to, I guess, bring it up and let you understand how this fits into my research. So Brian grew up in regional Queensland. His father was an alcoholic and died from a heart attack, age 45, when Brian was 12. He's currently living alone. He's finished year 11 and worked in physically demanding jobs until his late 30s. He's currently going through a divorce. He has 2 adult children, but doesn't live with them. He does love to play chess, but he's got very, very little time outside work. So he's got a bit of a work-life balance issue, like most people do these days as well. In terms of health, Brian is a moderate to heavy alcohol consumer. He has been throughout his life. He's got unhealthy eating habits. Most of his life, he's actually ate junk food and didn't really exercise. And as you can see, he's quite overweight, probably obese since his late 30s. He's been diagnosed recently with diabetes, depression, high blood pressure, and cholesterol. which is very, very common given that a significant majority or a section of the Australian population is diagnosed with comorbidity. His doctor keeps telling him that he needs to change his diet, he needs to actually exercise, he needs to actually perhaps leave his work and work for a much less stressful work environment. He hates it, he can't. He hates taking his medications. He hates how much they cost. He hates going to the doctors to actually pay for it. And he's repeating high levels of burden in trying to manage his multimorbidity or depression, high blood pressure and diabetes. He cannot afford private healthcare either because he's got a mortgage to pay, he's going through a divorce, he's just getting by. So that's Brian's health history. In terms of his working conditions, he's working in a sedentary work environment. He's sitting in front of a computer and talking with clients on the phone most of the day. He often works weekends and evenings to meet demands. Many of us can actually relate to that. His clients are very, very demanding, and sometimes they are verbally abusive for Brian. He's highly stressed because of trying to meet deadlines and performance indicators. His boss has just told him that if he doesn't have this particular contract run in place, that he could be looked at getting made redundant. He's got a very authoritarian supervisor who offers minimal support. His work colleagues are very competitive and unsupportive. It sounds like an awful workplace to work, doesn't it? Junior staff, although not Brian, are bullied and pressured in this workplace. In general, there's a culture of stress, or a very stressful workplace culture present within this large marketing firm. So my research essentially is about, well, how do you actually combine all of these major elements that are operating for Brian at the moment? How do we improve health and well-being for Brian? How do we actually improve his quality of life? How do we help Brian and millions of other people like Brian who are suffering from, a stressful work environment, having to live with a burden of a particular chronic condition or number of chronic conditions? How do we improve the healthcare system? So that's where my research comes in. My predominant research areas are around occupational health, particularly from my psychological background as well. I like the aspect of psychosocial health. So that's about workplace stress, shift work, bullying, harassment, the hazards that actually lead to a particular stressful or a toxic workplace culture, work-life imbalance or inability to actually balance the demands of work and non-work environment. I also like mixed methods research. So I was trained in quantitative survey research in psychology, but in my public health degree and PhD, I sort of fell in love with qualitative research, which direct me into the path of mixed methods research. And I really like innovative forms of data collection. So that's about, nominal group techniques and Delphi methods. So one of my PhD students at the moment is looking at a photo elicitation method where she's trying to understand what well-being means to young adolescents. And she's actually getting them to take photos everywhere they go, and then beneath those photos make a sense of what those photos mean to them. So a photo of the beach, for example, or a photo of spending time with their cat, or a photo of spending time with their grandparents. What does that mean for this idea of holistic health and well-being? So that's one area that I'm interested as well. I'm also interested in chronic disease. I worked in a research intensive position for Australian Institute of Department of Health and Aging, and I'm particularly interested in sort of the things that we create to treat chronic disease. Yes, chronic disease is the epidemic of our times. A lot of people do end up having them, particularly now with an aging population and an increased life expectancy. You and I probably will experience some form of chronic disease. I'm more interested about, okay, how do we help people manage that particular chronic disease? And what is the intersection of that chronic disease with the person's work environment, family environment? How do they actually align? How do they come together? Which leads to this idea of person-centered healthcare. So treating each person holistically, like individualized, personal healthcare, rather than treating people like robots or having a one-size-fits-all approach. So some of the PhD projects that I'm currently involved in, so as you can see, there are some lists over here. I've been involved both in Australia and overseas. One of my PhD students has recently completed evidence-based practice for acute stroke care in Ghana. Another PhD student looked at the occupational stress experienced by ambulance service personnel in Queensland and some of the abuse that they actually cope on the other end. You know, my other PhD students are looking at wellbeing and lifestyle behaviours in young adults, psychosocial wellbeing among academics in Thailand and Australia. I'm sure we could probably participate in that survey. It would be interesting to look at psychosocial wellbeing at the moment with COVID-19 and transition to online learning, and the further blurring of work and non-work life or aspects. My other student is looking at bus driver occupational hazards and shift work in Philippines. I've recently got one PhD student who's looking at the psychosocial health or the health of farmers who have a drilling or a gas hole in their farm as a result of from the unconventional gas industry. And these are some of the PhD projects that I have. So in a nutshell, these are the research areas that I'm interested in. If you feel like these align with your expectations or what you want to achieve, or even if you just want to have a chat about PhD that's not related to some of the topics that I'm interested in, feel free to give me a call. We can discuss your aspirations over coffee if you're a coffee person like me, or over a cup of tea if you don't prefer coffee. I can perhaps buy you something else if you don't like either as well. So that's me. Thank you very much, Naomi.
Thanks, Adem. Can you unshare your screen?
I will. I'll do that right now. Pause share, stop share. Thank you.
Thanks, Adem. Sounds like some broad-ranging research going on in your neck of the woods there. Next up, we've got Associate Professor Reese Hinchcliffe, who is in Health Services Research and is our school's academic lead for international engagement. His research interest is in diverse health systems and services, and his research project aims to improve the effectiveness, efficiency and equity of healthcare. Take it away, Reese.
Awesome. Thanks for that introduction, Naomi. And thanks also to Sanjiwa and Jamie for facilitating this session today. It's something that I would have loved to have when I was looking at, prospective PhD opportunities. So I hope everyone who's listening today gets a lot out of it. I know I've only got 5 minutes, so I've got some slides to get through today. So I'll just share the screen. Okay, all right. So who am I? As Naomi said, I'm an Associate Professor in Health Services Research here at QUT. I've been here about 18 months now, and having worked, as you can see down the bottom of your screen, at a number of different universities, I can actually testify to the fact that QUT is a wonderful place to work. And particularly, I'd like to think in the School of Public Health and Social Work, and of course at OSHI. I'm also the Deputy Discipline Lead and Course Coordinator in Health Management and the Academic Lead of International Engagement within our school. And my interest in international engagement will come through in just a little bit when I talk about the types of projects that I'd be interested in supervising. In terms of my education, I completed a first class honours in social anthropology at the University of Sydney, where I also ended up doing my PhD in medicine, particularly focused on public health. And yes, I am from New South Wales, thus the blue screen you can see here. And I try to give a lot of stick to all my Queensland colleagues whenever, every chance that I get. In terms of experience, I've had research intensive roles. I've worked in government as well, so sat on the other side of the fence, because I think it's really important to understand not just knowledge creation, but its actual application to affect real change in the real world. And then for the last couple of years, I've had similar roles to this one, where I have a blend of research, teaching, and university administration. So what's my main motivation for my career? Well, one of my mentors throughout my career, Jeffrey Braithwaite, and colleagues recently published a paper that they titled the 60-30-10 Challenge in Healthcare. So what's that refer to? So if you look at the last 30 years, trends over that time and evidence from all over the world, it seems that around only 60% of healthcare is actually delivered that's in line with evidence-based or consensus-based guidelines. 30% is either waste or actually low value care, so a different way of expressing waste, and 10% actually causes harm to patients. And what's scariest about this is that those figures don't seem to have changed that much.
Hi Natalie, it's Adem, how are you?
Hi Adem, how are you going?
Good. Is this a good time to have a brief chat?
Yeah, all good.
Okay. Good, thanks for that.
I'm not sure if anyone else can hear Adem.
Kim contacted me last night just to sort out the sessional budgets. I asked her about, you know what?
I might just pause for a second here, just to wait. Adem seems Adem might have spent the last couple of days microphone, but that's okay. We all do it now and again.
Available at Q.
I'm sure we'll get. I'm sure we'll address this issue in
Jen's role. So apparently, a new policy started on the 1st of July where.
There we go. That's all good. Otherwise, I was going to try my singing skills, see whether I could harmonize with Adem in the background. Okay, so back to the seriousness. Well, hopefully it's not all that serious. It's more about changing the world and using your PhD to actually do that. So the 60-30 challenge is something that's been here for 30 years. It's still here. It's all around the world. So whatever ways that we're using to think about healthcare improvement, whatever we're currently doing, yes, it's making some improvements, but it's not creating those fundamental shifts that we really need to make the world a better place. So I'm looking for someone who's keen and motivated to actually do that. So these are my broad topics of interest. With 5 minutes, I don't want to get into too much detail. So my thinking is, these are the general areas. If you're interested, contact me using my email address on the final slide, and we can actually continue the conversation, because it's not just about finding topics that we're both interested in. It's also about us being able to work together effectively, and we're only going to know that if we speak together. So the first topic is all about the design and implementation, and of course the impacts of quality and safety policies and large-scale programs in the health sector in Australia and internationally. So I've conducted a lot of research around the world, particularly in the field of healthcare accreditation programs. And you can have a look at my Google Scholar profile to get a better idea of exactly what angles on that topic I like to investigate. Linked to my interest in international engagement is my growing body of research regarding the implementation impacts of universal health coverage programs and also other health system strengthening initiatives in middle-income countries, where the majority of the population of the world lives. We're facing dual burdens of disease. So I really want to see people who want to try and strengthen health systems in those contexts, and I'll do my best to help you with those projects. Being also a teaching academic, I'm also curious about evaluating educational programs like Masters of Health Management, like the one that I actually coordinate, because it's not just about implementing initiatives in the health sector, but also how can we best train the future workforce and future leaders of health systems to be able to come up with the solutions that people of past generations haven't been able to. And finally, and linked to that point, I'm also really curious about examining and also finding ways to improve international student experiences in Australia. It's a topic that's quite dear to my heart, especially in the current climate where a lot of international students in Australia are having quite a lot of challenges. So I would like to conduct research with you, looking at ways, innovative mechanisms to actually ensure that international students are cared for appropriately and maximize their experience of learning in Australia. So they're the topics, but what are the types of criteria that I'll use to assess whether or not I want to supervise someone? First of all, subject matter expertise. So if you're proposing a topic that you have no history of working in that area or no research on that topic, it's going to be very difficult for you to hit the ground running. So I really want to see people who have a demonstrated capacity to understand the topic or the sector they want to conduct research in. The second key criteria is in relation to research skills and experience. So I'm not just talking about the mandatory entry criteria for a PhD. but I want to see additional evidence of your capacity to actually conduct research independently. So can you do systematic reviews? Do you understand study design principles? Do you know how to collect data and analyze data? And perhaps equally as importantly, I want to have students who can actually write professionally and academically. Of course, you'll learn these skills as you progress throughout your PhD, but there's really not much time. So I'm looking for people who already possess these capabilities. And finally, as I alluded to earlier, it's all about personal qualities. So by that, I mean someone who's determined, because let's face it, it's a hard slog for 3 to 4 years. Someone who's good at working with others, at collaborating, not just with their supervisors, but with also other PhDs. Because in the school, we like to think that our PhD students are a community of practice that all support each other and learn from each other. And finally, which is the trickiest one sometimes, a willingness to receive constructive criticism. So no matter how high achieving you've been with your prior studies and your professional career, if you're entering a PhD, you're going to get a lot wrong. And my job as your supervisor is to, as carefully and politely as possible, actually tell you where you've gone wrong. So I'm looking for people who can receive that constructive criticism effectively. What are the expected outcomes that I would look for from a PhD student? Well, firstly, it's about you, really. I'm the supervisor, this is your project. So I want you to graduate within around 3.5 years as a professional researcher with good employment prospects, either in the university or other sectors. I'm looking for students who want to complete their thesis by publication. So around 3 to 5 either published or accepted articles in high quality journals, because that's going to facilitate your career prospects and also help me hit my key performance indicators as an academic. And also someone who wants to maintain links with me post-graduation from their PhD. So, you know, we can build a team investigating issues such as what you'll investigate and maybe other things. So this is more, a PhD is the start of the journey of working together to try and change the health sector, make the world a better place. So for further information, I encourage you to contact me at the email address listed there, but also have a look, do some online snooping and have a look at my QUT webpage and my Google Scholar profiles. And whether you're keen to pursue a PhD with me or not, then I'd also like, why not connect with me on LinkedIn and Twitter? At least you'll get a better idea of the types of issues I'm passionate about, not just in my research, but you know, also more generally in my life. So thanks very much. I look forward to having further correspondence with many of you over the coming weeks, and I hope you enjoy the rest of the session today. Thank you.
Thanks, Reese. We're very proud here at PHSW of our social media presence. So I'd encourage everyone to do a little online snooping, as Reese says, and look up our academics on the social media platforms that we use, and to also follow our school on Twitter, Facebook and Instagram as well to keep in touch. Next up, we have another visit by Professor Stephen Macphail. This time he's going to be talking about his own research and opportunities for PhDs within that. But before we get started with Stephen, I'll just quickly introduce him. He's the Academic Director of OSHI and leads the Health Management discipline at PHSW, in case you missed it last time. He's also a Flagship Research and Education Director for the Australian Digital Health Cooperative Research Centre and a Co-Director for the Centre of Healthcare Transformation. Steve is an internationally renowned health service innovator, health economist and researcher working in partnership with health services to design, implement and evaluate effective models of care or system changes to improve patient care at low cost or with cost savings. Steve has been awarded more than $24 million in research funding from international and national competitive schemes. Thanks, Steve.
Thanks, Naomi. I'll have to thank whoever wrote that. That was very a very generous introduction. Thank you. If I could just also thank all the other presenters who have really covered some good material around what to expect from a PhD candidature, and also the sorts of things that make good PhD candidates. I thought rather than give too much further content on that, I'll just tell you a bit about myself. So I actually started life as a clinician. Well, I mean, there was a few things before that. Went to school, learned how to, you know, walk and talk, stuff like that. But in my working life, I started as a clinician, and then working day to day in health services, I became sort of a little bit, I guess, discouraged by the fact that sort of treating one person at a time was not really, was not a really efficient way to actually solve the bigger problems. And there is a lot of problems in our health services. There's a lot of opportunities for improvement. And rather than to stay doing work that was, I guess, limited in its impact because of just seeing one person at a time, I thought I would like to fix the system at a larger scale. And that naturally led me to doing research, and then actually I retrained in health economics, did a PhD in health economics. And now I work with good people, a lot of good people. And that's really the key here to doing good research and having a good candidature is to work with good people. And we, the main things that we do is try to solve problems in health services, and bring innovation to life is one of our sort of missions. But what that really means is that we have, at the moment, a real problem in our health system, whereby we have new technologies coming on board all the time. We have new innovations, new treatments. They typically cost more than what is already available, but we have limited resources. We have increasing demand in our health services. And this is a bad equation, really, for wanting to provide sustainable and effective and accessible health services. And so we work with health service partners to try and fix this situation. And that includes bringing in the most promising technologies, most promising interventions, most promising models of care. But a key part of it is also stopping things that don't work, or stopping things that are not good value, where we could be doing something better. And given that there's really limited sorts of resources in the healthcare sector, and we're seeing this at the moment through the COVID pandemic, the system is a little more frail than people realized. However, it's also been amazing to see how health services across Australia have responded and really adapted to difficult circumstances. Now, you know, in this case, the COVID curve was squashed in most parts of Australia, you know, very thankfully. But now we have to figure out which things that we did were worthwhile and we should keep, and which things weren't, and we should actually change and go back to the way it was before. And you know, this is really important in areas like virtual care, including telehealth, but not limited to telehealth, and in some of the digital health initiatives that have been implemented. This is just scratching the surface. If you'd like to hear more about some of the work we do, please check out, you can always look up our publications, of course, and check out the AUSHI website, Australian Centre for Health Services Innovation. I thank you all for your time, and I hope I'll get to meet some of you in due course. Thanks a lot. Thanks, Naomi.
Thanks, Steve. Next up, we've got Professor Will Parsonage. Now, Will is the Clinical Director of the Australian Centre for Health Services Innovation, AUSHI, and part of QUT's Centre for Healthcare Transformation. He's a Senior Staff Cardiologist at Royal Brisbane and Women's Hospital and Visiting Cardiologist at St Vincent's Private Hospital, Chermside. He is a member of the board of the Cardiac Society of Australia and New Zealand and the incoming chair of the Society's Quality and Standards Committee. Will has had a wide-ranging research career spanning experimental physiology for his higher degree research and subsequently in application of clinical diagnostics and treatments, particularly focusing on value-based healthcare. That's come up quite a bit with a lot of our presenters today. He also has a specific clinical and research interest in heart disease during pregnancy. So let's hand over to Will.
Good afternoon, everyone. I'm delighted that you have joined the webinar this afternoon. I'm sorry I can't join you in person. My name is Will Parsonage. I'm the Clinical Director at AUSHI, the Australian Centre for Health Service Innovation, and I'm also a practicing cardiologist in Brisbane. If I look back in recent decades, we've seen huge improvements in the survival and health outcomes for patients with cardiovascular disease. So in 2020, if you're 50 years old, you're much less likely to suffer a heart attack than you would have been, say, in 1970. And if you're unfortunate enough for that to happen, then these days you're much, much more likely to survive. These improvements have arisen from a combination of public health strategies that are based on a better understanding of modifiable risk factors and tremendous advances in technology that have been applied across the board really to diagnostics and therapeutics with drugs, devices and surgery. But there are still substantial challenges in front of us. Cardiovascular disease still accounts for around 14% of the total burden of disease in Australia. More than a quarter of all deaths are due to cardiovascular disease, and more than 10% of hospital admissions are attributable to cardiovascular disease of one form or another. And some of those advances that we've seen in recent decades will be challenged and potentially reversed. We've got a growing and ageing population, and whilst we've seen falls in the number of, for example, people smoking cigarettes, some of that might be offset by an increasing prevalence of things like obesity and type 2 diabetes. The other major challenge is that those improvements in cardiovascular disease have not been equally realised across all sectors of our community. Substantial disparities remain. There are very important differences in the services that we provide and the outcomes that are based on factors like sex, socioeconomic group, and most notably, of course, in Indigenous Australians. So, if we are to continue to see the advances that we've enjoyed over the last 30 or 40 years into the future, and if we're to see all of our people benefit from those, we will need not just new technology, but also health services that are efficient, accessible, and equitable. As a PhD student with OSHI, you'd be ideally placed to take on these challenges. Our group have established strengths in health economics, biostatistics, implementation science, and health services research, as well as a proven track record of collaboration with frontline clinicians. That collaborative network has strength at a local, national, and international level, and our group have a growing interest in cardiovascular disease as an area of study. One of the major advantages of our broad-based research strength is that it enables us to work across almost any clinical area and with a wide variety of clinicians. So whether your interests lie in economic evaluation of a new diagnostic method for a common problem like high blood pressure or heart failure, or whether you're more interested in how best to deliver evidence-based care for a rare disease or in a remote community, we'd be interested to hear about that. There's no doubt that this has been a year of great challenges for all of us in many different ways. But if we're learning anything, it's the importance of the health services that we often take for granted, and more importantly, the capacity of our health services to adapt to a rapidly evolving future.
Thanks very much, Will. We're moving on now to Dr. Sanjeewa Kularatna, who is a health economist and a health service researcher here at PHSW. He's also a senior research fellow at OSHI and the Centre for Healthcare Transformation. Additionally, Dr. Kularatna is the academic lead for postgraduate research here at the school. And since taking on the role as academic lead for postgraduate research, Sanj has been absolutely committed not only to attracting new PhD students to our school, but also celebrating their achievements and accomplishments. So it's with great pride that I hand over to Sanj, who's going to tell you a little bit about his work.
Thanks, Naomi. And many thanks to Naomi, and Jamie also is the face behind all this work. And thanks everyone for coming to our webinar. So my name is Sanjeewa, and everyone calls me Sanji or Sanj, doesn't matter. Whatever you call me, because it's easy. As Naomi said, I'm health economist at School of Public Health and Social Work at QUT. And I'm also the academic lead for postgraduate research for the school, and also the senior research fellow at the Australian Centre for Health Service Innovation, which is OSHI. It is a premier health service research centre in Queensland, and then maybe arguably in Australia also. So And the Center for Healthcare Transformation, which is a center from the Faculty of Health, is a collaboration between our school and School of Nursing. So I have access to many other course supervisors and within statistics, nursing, implementation science, and health law, among others, for my PhD students. So as the academic lead in postgraduate research, I help PhD and MPhil students to find supervisors and also generally guide them in the application process. Therefore, even after this webinar, if anyone has any questions about supervision and finding supervisors, I could be the contact person for the school and gladly help you find a suitable supervisor within our academics. Anyway, I'm also looking for PhD students and have the capacity to take up PhD supervision at the moment. And naturally, my interest areas are health economics and health service research. And most of my research is linked to Steve Macphail and also Professor Will Parsonage. And you saw him living his life in study our Stradbroke Island these days. That's why he couldn't come in person and then provided us, very kindly provided us with that video. So I personally like to guide my students to do practical and applied research, which will be useful in their chosen career. That's how I see that it needs to be very practical. However, before anyone starting doing a PhD, you need to think about what you would like to do for the rest of your life. Because PhD is in specializing in a specific area and becoming an expert, there's no, my belief is there's no point doing something else after spending so much time and efforts into a PhD. So you have to have that commitment that this is your career. That expertise, however, should be marketable in my opinion and be relevant in the job market afterwards. So the PhD should be able to propel you into higher things and then rather than being a burden. Now with health economics, practicality of doing health economics to be valuable in the job market in the future life is if you search Seek, which is one of the premier job search engines, you will come up with long list of health economic jobs at any time, even now. So not only academia, health departments, community health providers, large pharmaceutical companies, UN agencies, large consultancy companies recruit people and pursue people with health economics training and capacity. So with my PhD students, I like to give them a skill set which help them to become confident health economics and health service researchers. I spend time on them and support them making it an enjoyable journey. As an example, my current PhD student is writing his 7th paper within his PhD while having more than 7 months to complete his 3 years. So he's in 2.5 years now and just completing his 7th paper, which include 2 systematic reviews, a Markov modeling, 2 Markov models, 2 Markov modeling papers, a machine learning, and a discrete event simulation modeling. So it's a complete skill set for a health economics, I think. So that's how I want to progress my PhD students. Most of my research bond with my colleagues at OSHI, including Steve and Will, and Adrian Barnett, who would have who would follow up later with a video again. And I facilitate collaborations between my co-supervisors and always happy to include expert co-supervision with my PhD students, which would be really helpful to them. So in conclusion, I have specific interest in modeling in healthcare, economic evaluations, and specific interest in heart disease, and then something called discrete choice experiments. As I said, my preferred area is heart disease because I have been continually supported by the Heart Foundation for a long time now with fellowships and grants. So, and this includes patient-reported outcome measures, and then especially on something called quality-adjusted life years, which is a preferred outcome measure in economic evaluation. So my specialty area of research is quality-adjusted life years of QALYs. So with economic evaluation, I have built econometric models to look at cost effectiveness of new health interventions. By building Markov models, you can provide evidence for decision making based on cost and patient-reported outcomes. These are really useful in reducing waste in healthcare and making efficient resource use and helpful in decision making. So that's why I believe by doing this research and then contributing that we are making a difference to health service, also something to our world. So I'm also working with research programs to build capacity in measuring consumer preference, which is what I call discrete choice experiments in various health interventions using these new methods. With this method, we can measure how much patients would prefer one type of interventions over the other, and we can provide a dollar value for that preference. This again can be really helpful for decision making, because it gives us the preference of patients with a monetary value. So if anyone is interested in economic evaluations, finding consumer preference in healthcare and patient outcome measurements in relation to heart disease and generally any other disease, but I prefer heart disease because that's the area I want to focus, I'm more than happy to discuss projects, ideas, and options with you. Then in a last note, I really like working for OSHI and School of Public Health and Social Work. We get real good support from Steve, Megan, and Hillary from the school. And it's really nice place to work. And for students, it's really a collaborative place. And we support PhD students as a part of our family. That's why lots of people like to come and work for us and to be our PhD students. And you can check my QET website profile and also my email I'll post down here if you want to contact me. Thanks again. Have a good day.
Thanks, Sanj. Next up, we have Dr. Bridget Abel, who is a research fellow in implementation science and clinical epidemiology at OSHI. She works collaboratively with organisations and healthcare teams to plan and implement health service innovations and conduct clinical and implementation evaluations. Consequently, her work straddles the worlds of academia and clinical practice, and we see that a lot in our school. She has research experience in projects across a number of fields, including cancer care, physical activity, cardiac rehabilitation, mental health, child health, public health, and emergency medicine. Her current projects include developing a new model of care to improve mental health outcomes in regional Queensland, understanding the implementation and use of digital information in hospitals, and mapping evidence for exercise in the secondary prevention of coronary heart disease. Looking forward to hearing from you, Bridget.
Thanks, Naomi. So my name's Bridget. I'm also a research fellow in OSHI in the Centre of Healthcare Transformation and the school. So I'm an implementation scientist, and so you might wonder what that actually means. So implementation scientists are all about taking evidence or things that we know work or new ideas or solutions and then putting them into practice. And using behaviour change techniques, systems thinking, complexity thinking, and implementation strategies to then change healthcare for the better. So it can be in terms of the patient level, it can be at the provider level, the hospital or policy level. So we work across the broad spectrum. And that's also why I have experience in a lot of different fields, because as an implementation scientist, you actually have a set of skills which are applicable across almost every discipline if you work with somebody who has the specific clinical knowledge that you need. So it's a really interesting field if you're to get into. It's also a growing field. It's in increasing demand, as you might be able to imagine. But we have a lot of things that we know work and we can never actually get them to work in practice. We don't know why people choose not to do things. So that's what implementation science is about, and that's what I do, which is really interesting for me. And projects, obviously, across a broad spectrum of clinical areas are completely welcomed. It depends what your interest is. We could probably tailor something to you. And we have different people in our group that we can work with as well to get that clinical expertise. Or if you come to me with some clinical expertise, that's fabulous, because then I can teach you the implementation skills to be able to start putting things into practice. So that's my main area of work, implementation science. And as part of that, we also work with the health economists at OSHI, a lot of times in our implementation and also evaluation. So you might be able to get some skills in health economics as well when you come and undertake implementation science studies. The other area that I'm really interested in as well is secondary prevention of heart disease. I'm another one of the cardiology group at OSHI. But my specific focus is cardiac rehab and secondary prevention. It's something I'm passionate about because I have a previous life working as an exercise physiologist in the clinical setting. So if you're a clinician, I understand where you're coming from as well. And so that's my passion. It's what I did my own PhD in, and I actually have a lot of connections in the field. I sit on the National Committee for Cardiac Rehab, and so I have a lot of research links and also clinical practice links. So if that's something you're interested in, I can definitely help you with that and get a project, help you with a project or some ideas, or we can find out what's happening around the country and maybe link in with some other researchers if that's what you're interested in. And I do have a project sort of along those lines at the moment. And we also have a project in congenital heart disease, if that's something you might be interested as well, that we're working on. So they're my two passions, implementation science and cardiac rehab. And if you come to me with a project about both of those, then I will snap you up really, really fast because that's what I love to do. But anything along those lines, I'd more than welcome you. Or if you want to have a chat about implementation science and what it is, other terms you might have heard are knowledge translation, dissemination, co-design, all this type of stuff is involved in implementation science, working with stakeholders and context and fitting things to context. So if that sounds like something you're interested in, or if you're a clinician and want some really valuable skills with your PhD, this would make you in really high demand. Definitely what Sandra was talking about with the workforce. If you're a clinician with these skills, it would be excellent for your future career. So that's pretty much me. I am happy to take on students at the moment. I have one student who's looking at clinical variation in maternity care at the moment, but I'm got capacity to supervise some more students as well. So please get in touch if you have any questions. I'll also put my email in the chat as well. So thank you everybody and enjoy the rest of the presentations.
Thanks, Bridget. I love the idea of you snapping up students. Snap, 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 snap. Okay, next up we've got Dr. Amina Tariq. She's a senior lecturer here at PHSW, and she's also affiliated with OSHI. She's got an interest in e-health, which is a kind of really popular area, and she's our e-health kind of expert in this, one of our e-health experts in the school, e-health and technology in the field of medicine. Amina is currently working on a really interesting project at the moment on digital health CRC, which she's working on a digital health CRC project, and the project's about evaluating the impact of social media use on family connectedness and well-being. And she's also looking at the evaluation of new treatment processes at DBA. So I'll hand it over to Amina, and she'll probably do a much better job of explaining her projects than I just have. Thanks, Amina.
You did a great job. So, and digital health is that complex. So my apologies for making you go through names of very complex project, but I do hope I do a better job at trying to engage some PhD students today. I hope everybody can see my screen before any technical problems, with digital health. We have seen how things can go wrong in the digital world. And that's actually my research. So it's very interesting this webinar has been so far. Quickly about myself, I really wanted to highlight that I am a software engineer. So those of you who are listening from a non-health background or, have done information system degrees or psychology, more than welcome here. Look, I did a software degree, then I don't know why, I did a master's in information systems, and I not only change domains, I change countries when I do degrees. So those of you who are listening to us from other countries, we are welcome here. Then I did my PhD in health informatics in UNSW, Australia, which was a very exciting experience because I had never worked in aged care before, didn't know the name of the medications. And I did my PhD looking at information exchange processes in aged care in Australia. So I think PhD is such an experience that gives you 3 years to actually work through a project. And I know most of you will be interested in doing that. Since then, 10 plus years, I've looked at diverse technologies. And when I say technology, I really mean all of them, like electronic health records, mobile health apps, combination of both, testing systems, anything you name. And somewhere I have looked at it, how it works in healthcare. And not only aged care, now I work across hospitals, primary care, community care, to look at different, applications of healthcare. So interesting times, like we know, world is changing with technology. So why am I here today? You need research experience and I need you. That's as simple as that. So let's keep things simple. What do I want? I want students who can come from any background, but have interest in innovative technologies and desire to work with patients, consumer carers, and clinicians. That's important to me. And you should be ready for some evaluation of health, social, mobile, or readable technologies, as we call them, to support care delivery, wellness, and healthy living. And now I have made you think that, oh, I love my mobile phone, so I should be ready for this research. So let me narrow down for you a little bit what I mean when I say my research areas. So a few examples of the projects I'm working in, and I am sincerely apologetic for the dense level of this slide, but I really wanted to give you some insight into what the project looks like and what will be the parallel skill set you should be looking into. So one of the project domain I'm very interested in is looking at novel health information seeking and encountering environments. And you will be like, what does that mean in simple English? It simply means that we will be looking at how social technologies that all of us are using these days, Facebook, WhatsApp, Reddit, forums, even Google has become a large social technology these days, what impact it has on health behaviors and even social behaviors like family connectedness, how our different generations are using these technologies to actually manage their healthcare. I'm also very interested in something that is so at the moment top of our conversations, health misinformation. In COVID times, I don't know how many times we have heard about how much misinformation is spreading. So I'm interested in understanding those behaviors, how it spreads, what are the types of actors, what are the motivations, and why people actually believe these things sometimes. So who is it coming from? And it's a very complex topic. It's not easy. Even Facebook hasn't been successful in managing this. So we know we have our work cut out. So if you want to do PhD in this domain, what you will need is, ability to critically synthesize literature. That's a must for every PhD. You need to be familiar with technology, how it works, how it came about, and human behavior in journal. And it's not about journal human behavior, it's about academically understanding theories of human behaviors. And then some demonstrated ability to actually look at large data set which are qualitative. Social media data is very much dense, the amount of posts we get every day, and likes and dislikes and commentaries we get. So if we want to understand that, we need to have understanding of how qualitative data works. So these are the skill sets that probably you will need to have if you want to pursue a PhD in this area. The other area of my research is much broader. It is more around evaluation of safety and quality of digital health systems. And it is more around, identifying what are the unintended consequences. We started Zoom session today with a lot of activity going on. Honestly, that was not intended. We wanted it to go as smoothly as possible, but things are not always like that with technology. I can see I'm flickering on too many screens as well. If that is happening, my apologies. But again, unintended consequences. So my work in healthcare is looking at these unintended consequences. So what will you need to be familiar if you want to do PhD in this area? Again, literature is very important. Your ability to appraise literature, evidence is fundamental. Then familiarity with socio-technical context. It's a very thick term. All it means is that technology is not happening in vacuum. We as humans are driving it, and we need to understand how actually the social part and technology come together. Obviously, if you have some demonstrated ability to conduct and write research, it's a plus bonus. I think we have already spoken quite a bit about, and you have plenty of information where to go for, but I really like to be contacted by students when they have done their little bit of homework. So looked at my profile, clearly have sort of some insight into what type of research they want to do, and their ability to share their credentials to make sure that we can actually, very succinctly and quickly guide them to the process. And I am one of those supervisors who really talk about expectations up front. You are up for research, I'm there to help. But it's important to have a conversation about that. My colleagues, Reese, already talked about expectations, so it's pretty much the same deal, but it's all about making sure that you're a member of the staff, you're a colleague, you're leading your research, and we treat you like that. It is important to make sure that our research is recognized, and we have published it, highlighted it on industry forums, because digital health is a space very rapidly evolving. So if it's a space like that, we need to make sure we are helping you to settle down and make sure that you're on top of things very quickly. So these are sort of the expectations which you can read in your own time. I know we were running behind, so I tried to be really quick, but Naomi will have my details and they were on the slide as well. If you feel free, please contact me. I look forward to some good digital health projects with you guys. Thanks. Over to you, Naomi.
Thanks, Amina. I was thinking as I was watching you, I cannot wait for your TED Talk. When is that happening? Next up, we've got Elke Hacker, who is an advanced Queensland research fellow who's a mid-career researcher in the skin cancer field. And over the last few years, she's improved our understanding of the interplay between sun exposure, genetic susceptibility, and skin cancer risk. And it's probably more than the last few years, isn't it, Elke? I kind of popped that in because there was a bit of a gap in the bio. Maybe you can go into that a little bit. Thanks, Elke.
Thanks very much, Naomi, for the introduction. Hopefully you can see my slides okay there. I would like to talk to you today about the research we undertake, which is testing new technology to prevent skin cancer. Skin cancer is a big problem in Australia. 2 in 3 Australians will be diagnosed with skin cancer before they are 70. This is largely due to fair-skinned people living at close proximity to the equator, where we have high UV, sunny days and lots of sunburns. Luckily for us, skin cancer is preventable. And so we've seen a lot of great work looking at sunscreens and other prevention methods that will help us reduce the burden of skin cancer. So that's what my research does. We evaluate and test technology to prevent skin cancer. There's a whole range of different types of technology we look at. And I'm just going to go through different platforms to give you a scope and feel for the areas that we are researching currently. So we look at apps and software. So these are looking at platforms where we can message people about the risks, maybe change their behavior with certain messaging and prompting. And these sorts of technologies we trial in different outdoor settings. They were running during the Commonwealth Games as well as other outdoor events. We also look at sun awareness prompts. This is the sorts of technologies that we see coming out where we think it may be able to prompt someone to change their behavior. And during the Schoolies event last year, we had on every wristband a silicon slider that changes color. So it's white when it's not in the sun, it changes purple when it is in the sun. So this is looking at innovative solutions to high UV environments to look at how we can change someone's behavior and prevent skin cancer. We also look at sunscreen reminder technology. So this is looking at how do we know when our sunscreen's worn off. We have lots of technology coming out looking at UV cameras, which reflect where sunscreen is. You can see it's clear on a normal camera, and in a UV camera photo, you can see the sunscreen's reflecting and it's half applied to a face and half not. So this sort of technology shows you where you've missed or when it's no longer effective. We also test sunscreen reminder technology in the form of stickers, which have a filter on them that protects the photochromatic dyes in them. So again, this new technology allows us to put sunscreen on top. It changes color when the sunscreen's worn out. And these sorts of technologies we test at different settings. We tested this one during the Ashes in 2017, and we've tested it at other sporting events most recently. So this is where we sort of look at how do we get behavior change and technology to come together to prevent skin cancer. Some of our newer technology is looking at IoT devices, so Internet of Things, making something smart and giving us objective measures back so we can better evaluate our health programs. So this is looking at, in a setting such as a school, we could get metrics back on how much sunscreen is actually used, which is then timestamped to when it was used. So this would give us better evaluation and objective measures of what sun safety programs in which schools are working the best. And then we also look at some molecular approaches. So this is actually human skin, where we've given a very small square sunburn equivalent to 15, 20 minutes in Brisbane summer sun. And we look at the molecular changes. We're always interested in what is happening in its response to sunlight in these skin cells and what new technology could prevent these skin cells from going on and becoming cancer. So this sorts of lab work or molecular profiles generate pink cells, the cells that have DNA damage. Blue cells are normal cells, and green cells are melanocytes, the precursors to melanoma, the most deadly form of skin cancer. So this work is really looking at molecular pathways and really getting in the lab and understanding, as well as looking at better ways to prevent and develop sunscreens that prevent the molecular changes. And then we go all the way to technologies such as virtual reality, which is our latest project coming on board, which is looking at can a virtual reality experience improve sun protection behaviours. So I've got a short video here just to show you the gameplay behind what we've developed with our prototype. So hopefully this works. So if you have any questions about the different research projects that we look at, or you're interested in any of those technology and platforms that we're using, or any of the behaviour change work, please feel free to email me, and I look forward to connecting with some of the students that are interested in this body of work. Thank you for your time.
Thanks, Elke. I'll get you to pop your email in the chat like everyone else has, so that we can easily access it. So it's some really interesting research going on there, and some important research too, with 2 in 3 Australians by the time they're 70. Wow. Dr. Julie King is next, and she's a senior lecturer in social work here at the school. She is a medical anthropologist with a strong interest in disability and gender in low and middle income countries. She takes a human rights and inclusive development approach to working in numerous countries, including Asia, in Asia, Pacific and Africa. She has researched in Thailand and Cambodia, and conducted training in Nepal, Fiji, Cambodia and Tanzania, and in the areas of disability, human rights and gender. And before we go to Julie, we've heard a lot from public health researchers from our school today, but our school is actually made up of public health researchers and social work researchers. So it's a great honour to have Julie here talking to us and speaking on behalf of her social work colleagues and herself, because there are some really exciting research projects happening over there. Thanks, Julie.
Okay, thank you. Thank you for having me, Naomi. I guess this is a real change of pace for the type of research that we tend to do in social work. But I think it's always good to remember that a lot of us working in social work work collaboratively with colleagues from public health, from nursing and from other disciplines as well. So a little bit about myself. I have a nursing background. Decided I really didn't like that, didn't fit with who I was. So I went back to uni and did a degree in anthropology and Asian studies. Having lived in Asia for a lot of my childhood growing up, I had a real connection. So I wanted to learn a little bit more about that. I then went back after that and did a Master of Public Health, focusing on tropical health. And it was really there because part of the component was actually doing research. I actually fell in love with research, particularly qualitative research. And I think that we often underplay the social side of research. It is actually a real privilege to understand people's lived experience, and particularly from a human rights or a social justice background. And having worked with Amnesty International, which is a grassroots human rights organisation, that really underpins a lot of the research that I do. So in social work and human services, we actually have quite a collection of different sorts of academics. We have social workers, we have human service workers, we have psychology, we have anthropology. So it is a discipline that draws on many different fields to actually answer the questions that society is facing in a qualitative way. So some of the sorts of research or the basis for research over there, we have academics that talk about critical reflection and reflective practice within service delivery and social work. We have policy reviews using critical discourse analysis. We use a lot of qualitative methods, and those qualitative methods sort of sit on this continuum from semi-structured interviews right down to autoethnography and ethnography. So we have quite a broad range of skills in relation to qualitative research. I think what is really important about social work and why it is really important, particularly in today's society, is that we answer the questions, the big social questions. We privilege the voice of those who are unable to raise their voices up. So people from refugee backgrounds, people who have disability, people who live in poverty, people who've experienced domestic violence. All these big questions are not just about numbers or percentages. They're about experience, about human experience. And that is a lot of the focus that we have in social work and human services, is that human experience, in order to be able to understand how those contribute to our social well-being. At the moment, I actually have 5 PhD students. 3 of them are international students, one from Vietnam, one from Bangladesh, and one from Nigeria, who you heard speak before, Aaron Phillip, who is just the most incredible PhD student. Most of us find that having PhD students is an absolute privilege. We love having PhD students because it gives us the opportunity to vicariously do research through PhD students. We learn probably as much from our PhD students as they may learn from us, and we become, you know, great relationships within supervision teams is about support, encouragement, and for supervisors to facilitate the success of the PhD students that we have. I tend to have a very open door policy with my PhD students. I want them to have passion, and I guess you've heard before some of the things that we look for in PhD students, and really for me a lot of that is around passion. It's the passion to change the world, it's the passion to make a difference, it's the passion to stand up and be counted, and to assist in raising the voices of those that can't raise their voices. And so being in that role is an utter privilege. And I think many of the PhD students that I supervise also find it's such a privilege to hear the lived experiences of people whose voices are very, very rarely heard in society. The areas of interest for me are fairly broad. I work mostly with international students, or I work cross-culturally within Australia. So I work a lot in the area of people from refugee backgrounds, particularly if they have disability. I do disability research and gender research away from Australia as well. At the moment, I'm conducting a study looking at the safe transport or perceptions of safe transport for women accessing education or accessing employment in Bangladesh, Vietnam, and Cambodia. You know, because we will never meet the Sustainable Development Goals if we don't look at how women are able to journey safely to those places. And we're extending that to also look at health within those ranges as well. Other research is looking at our National Disability Insurance Scheme, which we have in Australia, and how that is related to people from refugee backgrounds or people from linguistically diverse backgrounds who do have difficulty because it's about self-advocacy. So I guess in summary, I'm looking for students who are really interested in social justice, about changing the world, about listening to voices that are often silenced, and have a real passion in those areas. So thanks, Naomi.
Thanks, Julie. Usually our social work and human services students are driven, aren't they, by this passion for social justice, and they're a very interesting crew.
We definitely are.
Next up, we have a video presentation from Professor Adrian Barnett, who is a statistician at Queensland at QUT, who's interested in improving the value of health and medical research. He's also the current president of the Statistical Society of Australia and has an awesome blog. So if you do, I might be able to pop that up in the chats whilst Adrian's speaking, but it's very informative and very engaging, so I encourage everyone to take a look at that as well. Over to Adrian's video.
So I'm very sorry I can't be there today, but I thought I'd record a quick video just to give some examples of 2 recent students who I've supervised in PhDs. The first one is Anisa Rahani Farid, who did a great project on Towards a Culture of Open Science and Data Sharing in Health and Medical Research. So Anisa basically just knocked on my door one day, and we had a great talk about science and how it could improve, and how talking about a lot of the imperfections that there were in science. And after Anisa went away and did a lot of reading, we honed in on this area of data sharing. So data is obviously key to science. People use it all the time, but scientists are very bad at showing other people their data and sharing their data, which of course makes it very hard for people to check what they've done or reproduce what they've done. So Anissa did some very simple but very powerful studies, including this one where we just looked at the British Medical Journal, which has a very strong data sharing policy. So if you publish in the British Medical Journal, you're supposed to say how you're going to share your data. So we said, great, let's look at some recent BMJ papers and ask the people who published in there if they would share their data. And cut a long story short, we only got 7 out of 157 data sets where people had promised to share their data. And some of the excuses were absolutely hilarious, like, you know, yes, you can have our data, but you have to pay us all this money, or yes, you can have our data, but you have to come to Bath in the UK. So this was a really interesting study, and very pleasingly, we got a tweet by one of the editors of the BMJ, Trish Groves, so saying that the paper was well worth a read, even though we were being critical of the BMJ. Anissa was an excellent presenter, and I really think her skills developed during the PhD on that. With a lot of practice, you do get a lot of practice of presenting at a PhD. It's not all about writing. And she talked about her research in open science and won the Queensland regional FameLab. And so then she got flown to Perth to present in the national final and met all sorts of wonderful and interesting people, including Barry Marshall, one of Australia's Nobel Prize winners. And although she was very nervous, she did an excellent job. It was all televised. And I think that was a great experience for her. And there's just a nice picture I found of Anissa getting the graduation day with Ginny Barber there as well, and myself. And Anissa's since moved to the US, where she's worked at both Yale and Johns Hopkins in this area of improving science. A second student, and then Anissa was a full-time PhD student. The second student I want to talk about is Nina Melancelli. She was a practicing dietitian, and her PhD was on gestational diabetes. And that really came about from her noticing repeated problems with women who had gestational diabetes in Queensland, and the way the system dealt with them and the clinical guidelines. So Nina did her PhD part-time while practicing and while also having a baby as well. And I think that also inspired her, because I think she had gestational diabetes with her first baby as well. So, and Nina did very well, and she's just about to get awarded any day now. And then this is just a very nice thing that happened with her last paper. The journal did a sort of infographic summarising the paper. So she did a pre-post study comparing what happened before and after this major policy change about how gestational diabetes was measured. And cut a long story short, basically what happened was diagnoses of gestational diabetes went up, but outcomes didn't really improve for women. So some big headline advice for you if you want to do a PhD: pick a topic you love. That really leads to success. You're going to be with this thing for 3 years or much longer if you're doing it part-time. So you really want to be in love with this stuff. I think read widely. Can't say that enough. You should start off by reading everything you can, because you want to be the expert in this area by the time you've finished. Learning new skills is great, and take time out to do that. That's not taking time away. There's all sorts of stuff you could learn: learning how to write better, learning how to present better, learning a new programming language, all sorts of things. I think you should expect to be creative. It should be. The best PhDs are a remarkably creative process. And lastly, of course, expect it to be hard. We don't give these things out for free. So the fact that it's hard is something you should prepare for and cherish. If you want to learn more, I really recommend this great book by Inga Mewburn, How to Be an Academic. You can also look at her blog, which has a lot of content from the book in there. And Inga's really great at talking about the whole PhD process, or the pressures of being a PhD student. You know, great techniques for dealing with that and for improving your writing. And yeah, I really can't recommend it enough. So dip into that if you want to get a taste of what life's going to be like. And if you want to learn a bit more about me, there's my Twitter page there. And I've recently started a blog called Median Watch, and that's up there as well.
Thanks, Adrian.
Thank you.
I do recommend Adrian's blog, and I have put the link in the chat. And if you want to take a look at Inga's blog as well, both really great sources of reading material for you there. Next up, we have Dr. David Brain, who's a lecturer in health management and a member of OSHI. He's currently working on multiple projects in a variety of hospital and health services, looking at a range of clinical conditions from economic perspectives. So David's just in the office next door to mine. I hope we don't get feedback. Take it away, David.
Thanks very much, Naomi. Yeah, before I begin about myself, I'd like to thank everyone for coming and for staying online. I was pretty nervous having to go after Adrian because he's such a good speaker, so you'll have to deal with my Aussie drawl after hearing the dulcet tones of Adrian. Yeah, so as you've heard, our school's a wonderful place to be. There's plenty of stuff going on, and there's lots of inspiring and capable people to work with and learn from. I'll get to what I think I can offer shortly, but I'd like to tell you a little bit about my PhD journey. So I completed my PhD at QUT with the OSHI group in health economics, and I completed that in 2016. Career-wise, it was really the best thing that I've ever done because I went from just doing a job to really having a purpose. And the skills that I learned in the PhD mean that I'm now able to tackle problems and find solutions in health that can actually impact the way that services are provided to people and influence how our health system is actually structured and managed. My personal view of a PhD is that it's essentially a skills development opportunity. I viewed it really as an apprenticeship. It was the start of a lifelong journey of inquiry, critique, experimentation, exploration, analysis and scrutiny. And I think that with the right supervisor, the right colleagues and the right opportunities, you'll be able to not only learn specific skills, but also learn other important skills. Certainly learn about time management, certainly learn about handling pressure, how to communicate and present better, about how to receive feedback, sometimes constructive, other times less so, about being innovative, and also, you know, many other skills that you pick up along the way. In my PhD, I had the opportunity to really develop a specific skill and expand my toolkit as it was related to health economics. And this gave me a really great sense of accomplishment, made me feel very employable at the end of the journey. And undertaking a PhD is really a unique opportunity to dive deeply into an area that really fascinates you or captivates you. You certainly have time for mistakes. I made many mistakes. You have time for reworking, sharpening, and reshaping, like you'll never really have again in a normal job situation, because you do have this long period of inquiry. So there's some good things about doing a PhD, but however, as my year 8 French teacher used to tell me, David, life's not all fun and football, and he was right. The PhD certainly is challenging, but my advice for all of you contemplating a PhD is that you need to get at least 3 things right before you start, and that's similar to what Adrian's just presented. I think the first point is you do need to have at least some interest in your topic or idea. There'll certainly be times in your study where you're completely sick of the sight of the keywords from your study's title. So having an interest in your topic helps you get through those flat spots. It's a really difficult thing to sort of fake interest over a long period of time, like 3 or 4 years. Now, the second thing I think is that you need to get to know potential supervisors so you can get a feel for whether you guys would work well together as a team. And I think this kind of opportunity that Sanj and Naomi have put together is a really amazing opportunity, because you can get a good first impression of whether you'd like to work with a potential supervisor and whether you think a follow-up meeting is actually worthwhile or not. Also, you need to think about whether the supervisor has something to offer you and whether their area of expertise is the major area that you'd like to be learning in. So not everybody gets this opportunity. The third thing is you do need willpower and you need staying power. I think that most PhDs are probably 90% perspiration and 10% inspiration. And certainly in my experience, sustained effort trumped short bursts of brilliance. So that's my top 3 kind of guide of what you must have for a PhD. So what can I offer? I'm actually really fortunate to have a foot in both the research and teaching camps. I teach in the health management discipline here in the School of Public Health and Social Work, and I'm responsible for teaching health planning and health evaluation, and also a unit on health economics. But I also work within OSHI, the Australian Centre for Health Services Innovation, where I undertake multiple research projects alongside my esteemed colleagues, many of whom you've already heard from today. Similar to what Hannah was saying earlier on, I'm interested and excited by any idea that kind of explores new ways to structure, manage and deliver health services in order to provide more efficient and equitable services for the population. I don't have a clinical background, so I'm not really hung up on one clinical issue. I have a track record of leading and contributing to cost effectiveness studies, but I've also been involved in research projects that focus on measuring patient quality of life, the contribution of a particular issue to burden of disease, and then studies about clinical effectiveness of an intervention. My main areas of focus at the moment are projects related to liver disease. I'm a chief investigator on a national grant that's looking at non-alcoholic fatty liver disease. I'm doing some work on another grant related to brain cancer survivorship in children. And I also have some small projects related to solving some simple but fairly costly issues that we have in the Australian Emergency Department setting. I do have wider experience beyond these areas and have worked across a diverse range of clinical areas. I've done some work in hospital-acquired infections. I've looked at anxiety and depression, rheumatoid arthritis, venous leg ulcers, diabetes, COPD and other chronic diseases. So like I said before, I'm not really hung up on specific disease or condition. I'm rather more interested in good ideas that make the best use of solving our health budgetary problems. As a supervisor, I've been principal supervisor for one PhD candidate and associate supervisor for another PhD candidate and a recent MPhil student who's completed their studies. I like to think that I'm fairly approachable and certainly available to help students. And I take great delight in helping students and guiding them away from the many mistakes that I made in my PhD journey. So yeah, if any of the stuff I've chatted about today piques an interest with you, please feel free to get in touch with me. I'll put my email address and a link to my staff profile in the chat. But it's pretty easy to find if you just type in David Brain QUT into Google. So yeah, looking forward to hearing from anyone who's interested in following me up. Thanks, Naomi.
Thanks very much, David. Good to hear from you. Next up, we have Dr. Nicole White, who is a research fellow and statistician with OSHI. Her research combines advances in statistical methods and applications across several areas of health and medical research, including infection control, big one right now, health services, spatial epidemiology, and bioinformatics. She is currently involved in projects with the Digital Health CRC, Metro North Hospital and Health Service, and Metro North Hospital and Health Service, and I'm getting tired now, Red Cross Lifeblood. Take it away, Nicole. Looking forward to hearing from you.
Lovely. Thanks, Naomi. Thanks, everyone, for coming today. So as Naomi mentioned, I'm a statistician with OSHI. So I've been part of OSHI since 2017, and through this role, I've worked on a wide range of projects within health services research, as well as statistical consultancy. So in terms of my PhD and research experience, my undergraduate training was in mathematics, and it wasn't until my own PhD project that I had my first experience working with health data, and my project was on statistical models for analysing data in Parkinson's disease. So looking back at the time, I wasn't specifically looking for a health-related topic for my PhD, but I did have a general interest in predictive modelling and learning new ways of analysing high-dimensional data, or big data as we know it now, which I think cynically is a ploy to make statistics sound more interesting, but I'll leave that to you to judge. But since my PhD, and this is something that I didn't really appreciate at the time, but my career as a statistician has just given me so many opportunities to work across different areas in health and medical research. So some of the areas that I've had experience in, as Naomi mentioned, include genomics and bioinformatics, cancer care, infectious diseases and infection control, as well as environmental health. And also, I guess in addition to this variety, being a statistician within health has helped me gain experience working with many different types of data sets that I don't think I would have seen if I had chosen non-health discipline for my PhD. So I've seen everything from randomized clinical trials all the way up to large population-based observational studies. And all these present their own unique set of challenges in terms of managing the data. And they also require different statistical tools to address key research questions, which for me personally has been really rewarding as a researcher. So given my background, I guess it's pretty fair to say, just like David and maybe some of the others who have already spoken, that my research interests aren't tied to a specific area within health, but rather I'm interested in how do we best apply statistical modelling to make sense of complex health data in a way that's fit for purpose and can be used to inform health services decision making. So just to give you a few examples of the type of work that I'm currently involved in, one is I'm working with a large health service in Queensland, and they're interested in predicting patient risk of adverse events that they might experience during their hospital stay, such as a fall or an unplanned admission to intensive care. So for this project, we're working with data on over 300,000 hospital admissions and hundreds of patient and hospital-related variables. So we're applying high-dimensional predictive analytics to identify which factors are most likely to increase a patient's risk of experiencing an adverse event. And ultimately, what we're trying to do is provide clinicians with the tools to identify high-risk patients early, as soon as possible, and then ultimately help with appropriate management of these patients. Another example of a project that I'm involved in is with an organisation called Red Cross Lifeblood, who are responsible for managing Australia's blood supply to hospitals and health services. So one of the big challenges for Lifeblood is managing the impact of annual influenza season on reduced donation rates from volunteer donors and the flow-on effects for maintaining an adequate supply of blood products. So traditionally, one way to try and anticipate the impact of flu season is to actually look at trends from past years and use this as a proxy to try and predict how many donors do we need in order to mitigate any shortfalls in blood product supply. But as we all know, from year to year, the severity of influenza can be quite different. Some have very mild seasons, some are quite severe. So this isn't always the best way to try and predict and inform the allocation of resources and blood products being in this example. So what we're looking at for this project is actually trying to evaluate alternative sources of data, including social media and other sources of online data as proxies of estimates of influenza levels in the community, and combining this information with data sets from Red Cross Lifeblood to try and generate forecasts of donor availability over flu season to help ultimately to manage potential shortfalls in blood product supply. So they're quite two different projects, different types of data, but the types of tools that we're using are similar in terms of predictive analytics. So I think I will leave it there. So I don't have any specifically funded projects at the moment, but if anyone shares these research interests, I'd be more than happy to have a chat with you about potential options. And I'll leave it there. Thanks, Naomi.
Thanks very much, Nicole. And now on to our final speaker today, who is Dr. Olivia Fisher, who over the last 2 decades has worked in the mental health sector in clinical health promotion, community development, teaching and research roles. Her research focuses on social, emotional and cognitive predictors of the 2 continua of mental health wellbeing and mental illness, implementation science and health systems. Olivia is academic coordinator of the Graduate Certificate in Health Sciences developed by OSHI, and she is also author of a conversation article that recently broke the internet, and if you look up her name in the conversation, you'll be able to read it. Over to you, Olivia.
I'm pretty sure I did not include that in my bio, but thank you for, thanks for adding that in, Naomi. So I was a former occupational therapist, started out my working life in clinical work, and worked in a lot of mental health roles, employment, health promotion. So overall, I've spent about 20 years in mental health in all sorts of different capacities. And what actually led me into doing my PhD was a real sense of frustration about, I was working in health promotion, illness prevention work, and what really frustrated me was how much we just did not understand about prevention, how to do it, what would really work in practice. And, you know, we've talked a lot about waste in healthcare, and I think the ultimate waste is where something could have been prevented before it even started. So that was what kind of drove me into doing my PhD, which was on looking at parents and their mental health strengths, such as belonging and accomplishment, and how that had a relationship with their children's mental health outcomes, to be able to, you know, long-term, hopefully, do a lot more investigation around whether or not we can improve kids' mental health outcomes by working with their parents, potentially before they're even born. So after completing my study, I've started working with OSHI, and I've been very privileged to be working in the grad cert, where I'm supporting students from across Metro North Hospital and Health Service to implement projects. So I'm supervising a couple of those students personally, and so are lots of the others in the OSHI and health management team who you've already met today, in using really solid evidence-based approaches to evidence-based practice, and how to do health reforms really effectively. So I'm working now on a number of implementation science projects, which Bridget was speaking about before. So looking at the science of how we implement projects effectively and with sustainability. And what I really like about that work is just how much of it is human factors. So all of this, you know, psychology and mental health training that I've done is still very much coming into play in this work in implementation science. So the work that I do at the moment in supporting students is really around teaching health research processes. And I think that that's one of the things that I have to offer. I'm really interested in not just PhD students, but also anyone who's looking at doing honours or doing a master's by research, as well as obviously PhD students as well. So I really like the process. So how do you develop your protocol, your ethics, selecting measurement tools, all of that. The process side is really very interesting, and I love helping people to develop skills. And as Dave was saying before, helping them not to make the mistakes that I made when I went through. So just keeping it brief, if you are interested in mental health, if you're interested in the social, psychological, cognitive determinants of health, if you're interested in implementation science, I definitely want to have a conversation. I'll pop my email and Twitter handle into the chat box in a moment.
Thanks so much, Olivia. Well, we're actually at the end of our session of presenters right now, and we have allowed a little bit of time for any questions that have come up. So we've got two alternatives for asking questions. One is to pop your question in the chat and we can respond to it. But if it's a bit of a bigger question and not something that you can easily just quickly write down, we can also unmute you and put you on audio and you can ask. We've got Sanj here and some of the other presenters who would be able to answer any questions that you've got. So please feel free to pop your questions now or to request to be unmuted and we can answer those. In the meanwhile, for those of you who are stayers and have been with us for the entire 2 hours, a little ad for our school. You can follow us on QUT PHSW. So I'll look out for you on Facebook, Twitter and Instagram, and hopefully you can keep up with the happenings in our school by doing that. Sanj, it doesn't look like we've got any questions popping up in the chat. We've done a fantastic job, I think, today of covering a lot of the basics of the PhD and some of the opportunities that have arisen. So are you happy, Sanj, to say goodbye to everyone now? It looks like Sanj is happy to do that, so we might call it an afternoon. One of the things that has really come through in all of the presentations, and I've written it down on my paper here, is the word love. The presenters today have talked about their love for their work and for their projects, and it's very evident that they have a passion for what they do. And also what's been really clear today is we work within a school, but we also work in the broader community with our research work, and that's something that we're very proud of here. It also gives PhD students a lot of opportunities for work once they've finished their PhD and to gain experiences that, that are very unique. So before we end today, I would just get you to say whether or not you would like to hear from us again in terms of our Healthy Dialogues presentations, which are run every Wednesday in the school. So if you could just answer that question on the poll about whether or not you would like to be invited to attend the weekly Healthy Dialogues, that would be fantastic. And I'll just give a few moments for people to respond to that poll. I'm guessing the people who aren't responding won't respond, so we might call it an afternoon. Thanks to Sanj for organising this really important event. Hopefully it's been very informative for people. And thank you dearly to all the presenters today who gave their time and energy to speak to our audience. Thanks very much, everyone.